Hi, I'm Sarah Keogh. I'm Dietitian with the Coeliac Society, and we are going to have a quick look today at eating for energy. When we talk about energy levels, lots of us are thinking about the energy that we need to just do our normal day-to-day things, if we're going to work or if we want to get some exercise in, that we have enough energy to be able to do that. Lots of things can impact on our energy levels. So, illnesses will obviously have a big impact, and lots of people with celiac disease would have talked about having really bad levels of fatigue before they were diagnosed. Stress is going to have an impact. If we have a busy lifestyle where we're not taking time to get enough rest or sleep, can have an issue. And then nutrition is going to make a difference. And, we do need a wide range of nutrients for good health and for good energy levels. But some of the big ones that can impact on our energy levels would be just not having enough calories, not giving your body enough fuel to actually work, which can happen sometimes if people are really restricting what they eat, maybe for weight loss or things like that. But low levels of B vitamins and low levels of iron are going to have an impact as well. And B vitamins are really important in our body because they help us to release energy from food. And so low levels of lots of different B vitamins can really impact our energy levels. And lots of people with celiac disease would have had low levels of vitamin B12 when they were tested, maybe just coming up to diagnosis or just at it. And in fact, lots of people are only diagnosed with celiac disease because they happen to have a low level of vitamin B12. So where do we find B12? So B12 is a B vitamin that's found really in animal foods. So you're looking at things like fish, milk, eggs, and chicken. Riboflavin, or vitamin B2, is found in things like eggs, lean meat, liver, green vegetables, and milk. Niacin, also known as B3, is found in things like nuts, pulses, fish, and beef. And then folate, or folic acid, green leafy vegetables, great source here. So spinach, asparagus, and of course liver again. So if you like liver, you're going to be doing very well for all of these vitamins. Iron is also a key nutrient for energy levels, and anyone who's had low iron will know how low your energy can really get when it's down. Really difficult to do lots of things. Iron helps our bodies to make red blood cells, and our red blood cells are what carries oxygen around our body, and we really need iron to get oxygen everywhere that it needs to be. And we use oxygen to make our energy. So if we have low iron, we end up kind of with maybe slightly lower levels of oxygen, more difficult for the body to make energy, and we can be really, really tired. So on a blood test, a low hemoglobin on your blood test can be a sign of lack of iron. So iron also helps to release energy from food, a little bit like the B vitamins. And we do know that people with good levels of iron or taking iron do see a reduction in sort of tiredness and fatigue. So what are the foods that we want to look for? So iron is found in red meat, in poultry, particularly in the legs. So chicken and turkey legs would be good sources of iron. Oil-rich fish will give you some. Shellfish, particularly mussels, are a great source. And then eggs are really good, but it's the egg yolk that has the iron, so make sure you do eat that part. On the vegetable side, you get plenty of iron in foods like green leafy vegetables, so cabbage, spinach, kale, all good sources. Beans and lentils are very good, so chickpeas, red lentils, green lentils, all really good sources of iron. And then seeds and nuts, so almonds, hazelnuts, pumpkin seeds, all really good foods to add in. Bear in mind, you want to be getting at least 2, if not 3 foods a day from this list, so you can understand why actually almost 50% of women in Ireland don't eat enough iron. What about iron supplements? So if someone is struggling to get their iron levels up, or they have very low iron when they're tested, often iron supplements can be used, and they can be really useful here. And very important if you're taking iron supplements is that make sure you do get a test in 3 or 4 months again to make sure that your blood iron levels did come back up. And then if you do stop taking your iron supplement, do get a test again and again, another maybe 3 to 6 months, and see is your iron levels staying back up. Because if they keep falling, you do need to have a follow up on that and just to check. And as I said, this is an issue that turns up a lot for people with celiac disease. So we need to keep an eye on our iron, and it's one of the reasons why we do recommend that you have your iron or hemoglobin levels tested once a year. The other food then that's important, particularly to help us absorb iron, is vitamin C, and this is where your fruit and vegetables are going to come in. We need vitamin C to actually absorb iron. It really just helps to boost the absorption of iron with meals. So what's brilliant to do is add in more fruit and veg. Make sure you're getting your 5 to 7 servings a day. So that can be having maybe some fruit with breakfast, having a vegetable soup or a salad with, at lunchtime, even with a sandwich or something on the side. And then at dinner time, making sure that vegetables or salads are a third, if not even up to a half of your plate at dinner time. So thank you. I hope you found that interesting. So we're really just looking at really good levels of iron and B vitamins, and then popping in your fruit and vegetables as well. If you have any questions or you want any more information, you can go to our website, which is www.coeliac.ie, or you can contact us at info@coeliac.ie.